This second lesson and patient communication and safety. Now we will move towards the summary of this lesson. So there is the quick review on the lessons. Most healthcare facility require that examination requested include patient pertinent diagnostic information and any infection control or isolation information. It is the radiographer responsibility to clear any vague or confliction information found on the requisition. Third one, patient must be identified by check their wristband and the requesting a second verification as such date of birth. Verbal communication involve the tone and rate of speech as well as what is being said. It involves personalizations and respect. Non-verbal communication involve facial expression, facial appearance, order line of the radiographic room, and preparation and efficiency of the radiographer. A thorough examination of procedures reduce the patient's anxiety, increase the concentration, and result in the better examinations. The radiographer provide aftercare information and can able address patient question about other imaging study. Now another summary. Radiological examination can be requested by physician or the physician assistant. Radiographer should be examine the requisition carefully prior to bring patient radiography room. Patient condition may be assessed through the chart information observation questioning or the vital sign. A patient vital sign are temperature, pulse and respiration rate and blood pressure. A normal adult oral body temperature is 98.6 Fahrenheit. Axillary temperature are 0.5 to 1 lower and rectal temperature 0.5 to 1 higher. The arterial pulse point include the radial, carotid and temporal, femoral and popliteal. The normal adult pulse rate uh, is 70 to 80 per minute. Infant and children pulse rate higher. The normal adult respiration rate is 12 to 18 breaths per minute, with the children respiration being higher up to 30. Dyspnea refer to difficulty in breathing. Other terms are used to describe specific respiration abnormalities. Blood pressure is measured using a sphygmomanometry. Sphy- Sphygmomem, sphygmomano, sphygmomanometry and stethoscope. The the average normal adult systolic blood pressure is 1200 mmHg. Average normal adult systolic blood pressure is 80 mmHg. Blood pressure is very Blood pressure varies with the person age, sex, fatigue and stress level and disease. With the trauma, systolic blood pressure contraction is top numbers, systolic pressure relaxation is bottom number. Next summary is the model of patient transport include ambulance, wheelchair and the stretchers. The patient and radiographer safety require the use of proper and safe body machines. Wheelchair and stretcher must be locked and wheelchair footstep positioned out of the way prior to the patient transfer. One person should be responsible for the safe transport of the IV line, catheter and other tubes. Patient transfer between the radiographic table to stretcher should involve pulling, not pushing. A smooth plastic board often helps. The knee should be bent when the lifting heavy object. Leg and abdomen muscles are used instead of back muscles. Heavy objects should be carried close to the body. The back should be kept straight and twisting motions should be avoided. Heavy objects should be pushed or rolled instead of pulled. Heavy objects should be pushed or rolled instead of pulled or lifted whenever possible. Patient belongings should be properly stowed according to the policy while the patient is in the radiographer care. The radiographer must be alert for the patient's safety and comfort at all times. Patients should not be left unattended in the radiography room. Should an accident occur involving the patient and the radiographer, an incident report should be completed regardless of how minor incident. Now the question: which of the following communication messages to the patient? Rate of speech, eye contact, readiness, radiographic room. This is the and this should be all 1 2 3 answer for this. Answer should be D. Yeah, answer is D. Now we will go to second questions. Second question is when an injured patient requires assistance undressing, the radiographer must remember place clothing on the injured site first. Remove clothing from the injured site first. Always start with the injured site. So answer should be A. Yeah, and second answer is A. Now we'll go to third questions. To reduce the back strain associated transfer patient's stretcher to X-ray table, you should pull patient, push patient, hold patient away from your body and lift, bend the wrist and pull the patient, push the patient. So answer should be A. So now we'll go to third one. The answer is A, right. Now we will go fourth question. The normal adult axillary temperature is higher than rectal temperature, lower than rectal temperature, same as rectal temperature, same as oral temperature. Lower than rectal temperature will be answers. So B will, and answer is B for lower than rectal temperature will be answer. Now question number 5. Prior to the relaxation of heart is termed systole. Answer will be A. The question is period of relaxation of heart is termed, relaxation is diastole always. So next question is the patient who is diaphoretic has pale, cool, clammy skin, hot, dry skin, dilated pupil, warm, moist skin. The pre-hypertension answer will be C. Systolic pressure is between 120 to 140 and diastolic pressure 80 to 90. So next question we will go. What number of breath per minute represent the average rate respiration for the normal adult? So 20 to 20 will be their answer. Next question is B1, and measure instrument needed to assess vital sign include tongue blade, watch and second hand watch with a second hand thermometer.